The Dorm Disorder podcast contains real stories, adult language, and occasional chaos. Some content may not be suitable for all audiences. Listener discretion is advised. Now on to the episode. Welcome back to the Dorm Disorder podcast. This is part 2.
I know you don't like cross country, but I think this is such an interesting story. Yep. Tell us about how cross country kind of circled back to you later in life.
Yeah, so I joined cross country because I wanted to lose weight because I was a husky. And so I joined and I hated every single minute of it. So Mr. Leek was my coach, and he knew I wasn't very good, but he encouraged me as much as he could. But I would find ways to try to get out of running. And there were days where I had cramps. If I ate, it's like, oh, I have cramps, I can't run today. I remember one time I started running, and then there was a tree branch that someone pushed out of the way. And then it hit me in the face, and I could have kept running, but I was like, oh, I can't see. Oh my God, I have to stop running. So I hated every minute of it, and I said I would never run again after I left Girard. And I went to Kenya as a medical student in the exchange program, and by that time I started working on the gym, and then there was no gym there.
Right.
And you're in Kenya, so what do you do if you're in Kenya? You run. And
so Kenyans do.
Exactly. And so I started running, and I've been running ever since. So I run many, many miles every week, but I always think in the back of my mind, so interesting that I do this now because I literally hated cross country, and I said I would never, ever run again in my life.
The worst part of running, the very worst part of running, is those first 5 minutes.
Yeah, when you're getting into it.
Yeah, because you're just like,
there's a hill.
Yeah, you're just like, oh my God, I don't want to be doing this right now. And then once the 5 minutes pass, once that first song ends, then I'm okay, because now I'm in the groove and we can just get through it. But those first 5 minutes, and the 5 minutes before the first 5 minutes, getting yourself up to get out there to go run.
I've raw dogged running my entire life. I will never, ever, ever listen to music while I'm running.
Oh, I have to listen to music. Yeah. I have to.
I'll sing a Jody, but I am not listening to music.
Wow.
It's running and listening to myself breathe and being angry in my own head, but no music.
That's interesting.
Raw dog!
I noticed you put that in there. It's like, oh, that's interesting use of word.
Yes.
That's for the young people.
Right.
The young people raw dog all kinds of things.
Right.
They raw dog flights. You know about raw dogging a flight?
Nah.
Yeah. Imagine flying far. No music, no book, no headphones, no nothing.
Yeah.
And they brag about this on the interwebs.
No, I need a show. I download all my movies. Yeah. Especially a long flight. Yeah.
Now you got to go raw dog one.
No. Unless I sleep. I guess I could sleep. But
you can't. No sleeping.
No sleep.
You said focus.
You know why they do that shit? Because they didn't have to do it when they was younger. They didn't have to do it in the 80s, 90s. We had a raw dog every day of our life. It was nothing. We had nothing.
No internet.
You in the car with your friends and your cousins. And
making up games.
Was driving, put on some shitty radio station.
That's why if you were a single child, you had to have an imagination because shit was boring. You'd be in that back seat, just talking to yourself, just having a conversation, making up some damn games. My mind was like, what the hell are you doing back there? Making shit interesting.
You're here for hours doing it.
Yeah.
Bad music, no internet, no phone, no computer game, nothing.
The game came out, but most of us was too broke to have that.
Yeah. No, I had the Tiger game. Tiger.
The Tiger game?
Yeah, the company was called Tiger.
Yes,
that's what I had.
And it had a little joystick?
No joysticks. It had buttons.
Oh, buttons.
But you would swing a bat and it would be here, and then it would be here, and then it would be here, and then the ball would fly, and then the outfielders wouldn't move. It would just
it would glide them or fall in or fall out.
Yep.
But that was what we had. It sucked.
Yeah.
I complained. It sucked.
Yeah, I didn't have Tiger or. I did have a Nintendo, the first one.
Nah, I had none of that. I had none of that shit. I had no.
So, definitely, we talked about how you were academically. When did you realize you wanted to be a doctor?
So this is a good Girard story. So, everyone asks you what you want to be when you grow up, and of course, especially if you're getting good grades. And so, I thought for sure, because I was getting good grades, I had to be a doctor or a lawyer. So I remember I was in 6th grade in the armory, and I was thinking about, I was like, okay, what am I going to do? Doctor, lawyer. And my rationale for wanting to become a doctor, it would evolve after that. But my initial rationale was lawyers have too much paperwork. And so that was my rationale, which I would learn later. Doesn't really make sense because doctors have a lot of paperwork as well. Yep. And interestingly enough, by the time I got into high school, I knew I wanted to go into healthcare administration. And so I remember having a conversation with one of our classmates, Latoya Williams, and her uncle was a healthcare administrator. And she told me what he did, and I just thought it was so cool because, of course, I wanted to work one-on-one with patients clinically, but then the opportunity to do that kind of work more broadly and to affect the healthcare of a large number of people was really appealing to me. And so I said, I probably will work clinically for some time, but eventually I want to go into healthcare administration so I can have that broader effect.
So that leads us back here.
Purple blood.
Yeah. And why don't you tell us, without giving too much away, because buy the book.
Yep.
Purple Blood. Amazon, hardback, softback.
Yep.
So, one, I've always wanted to write a book. That was like one of my bucket list things that I wanted to do. But I actually thought my book would be an autobiography, where I would sort of detail my life from childhood, and then I would go through, sort of everything that happened after. And then I had this unique experience. And so I was at Abington Jefferson for 15 years clinically in healthcare administration. And then I decided during the pandemic, where everyone was getting antsy, that I wanted to accelerate my career. And so my goal had been to be a chief medical officer. And that was going to take a long time at Abington Jefferson. But I found this opportunity in this semi-rural community in North Carolina. They were looking for a chief medical officer. They had never had one. So I took the leap, moved me and my family down there, took the job. And it was a very different experience culturally.
Wow.
So in my head, I'm thinking, I'm going to the rural South. I'm thinking of all these things. I'm thinking about my family and how they're going to be looked at. And that wasn't really an issue. But the issue was the hospital operated very differently than what I was used to. It operated very independently, although it was connected to University of North Carolina, which was this large academic and health system, but they were not really intimately involved. And so I was seeing all these very different ways of operating a hospital than what I was used to in Philadelphia. But then I was also looking at the people we were serving. Right. And so I had done my residency at Temple, and even at my time at Abington, we still had a significant underserved population. And so I saw that. And then I'm seeing these same people, basically, but they're now in rural North Carolina. And they have the same issues, they have the same problems, they have the same issues accessing healthcare. They're coming in with, really bad pathology where they let their chronic diseases get out of control, and we're catching them at the last minute. But the difference is, at Temple or Abington, they have access to all these specialists, all this high-level healthcare. It's there in North Carolina, but they have to drive 3 hours away to get to it. We don't have any specialists in the hospital. And so I wrote the book with that in mind, thinking through, we kind of have these very similar populations, even though people think they're very different because it's urban Philadelphia versus rural North Carolina. They have the same issues, but their access to resources is very different. So how do we make that North Carolina hospital more like the hospitals in Philadelphia? And so that's really what the crux of the book is about.
So I noticed, I don't mean to twist this too much, but I'm really curious, how many times did you have to hear the term, now look at here, boy? Now, when we talk about cultural differences, are we talking about the poverty rates? Are we talking about just the ethnic breakdowns? Like, why are these two places so different in terms of the healthcare?
Yeah, so that's what I was worried about, was the what you just said.
Yeah.
Look at board. And the South is very interesting, actually, because they're very polite.
Right.
And they may be thinking it in their mind or saying it behind your back, but they never want to say it to your face. So everyone was super nice. But the difference, I will say, the closest we got to that from the operations standpoint is there was a lot of, which actually, is what creates the book. There was a lot of, well, this is the South, or this is a rural hospital, so we don't do it that way. And these weren't extraordinary things that I was talking about or trying to propose. These were normal foundational pieces of how you provision medicine. And a lot of times it was, well, you don't understand how it is down here. And I did understand. And I wasn't trying to make it, a Philadelphia hospital. What I was trying to make it is at least foundationally what we should have clinically and what these people deserved, even though they didn't have a lot of resources. And so that's what I would get more so, is that I just didn't understand because I was from a different place.
So I actually do have a question, because there's some things going on even in Philadelphia. A lot of the local hospitals are closing, right? Hahnemann closed, and now we're getting into parts where there's people still living in those areas that now have to drive 10, 12, 15 miles to get to a hospital. And some of these are life-saving things that are going on, and ambulances are going to have to drive so much further. It's a concern. I'm just wondering if, when we're talking about North Carolina, if during those times, if you saw the same things, because you just said, people have to drive 3 hours to see whatever specialist. And that just made me think of not just Hahnemann, but, any local hospital.
This is the section of the interview where I give my disclaimer.
Yes.
So I do work for an insurance company that is the largest provider of Medicaid insurance in the country. And I am going to speak for Steve Spencer. I do not speak for them.
Yes.
So that's my disclaimer. So one of the things that's different, I think, in Philadelphia versus rural North Carolina is they both have access issues, but the access issues in North Carolina are more geography.
Okay.
The access issues oftentimes in Philadelphia are health literacy issues, so people have difficulty accessing the system. But the other thing that happens too is, because if you're poor or underserved, you usually have Medicaid. Yeah. Medicaid usually pays less than a lot of other insurers, and so a lot of the health systems don't want to take Medicaid, especially specialists. And so what happens is, you oftentimes can get primary care. Primary care will usually take everything. But then when you get to the specialty world, they really want commercial insurance.
Right.
And so if you have Medicaid, what will happen is you're sort of iced out. And so, where the commercial insurance person can get into someplace in a couple weeks, person with Medicaid may be 6 months. Yeah. Or they may have a hard time finding that person directly in their geographic area, so they are driving an hour to get to that specialist. And so that's where you see some of those disparities show up that can look a lot like North Carolina, because although we have, these huge, amazing health systems in our area, some of the people who need to be seen or should be seeing these people aren't seeing them because of the insurance issues.
You brought up healthcare literacy, and we kind of touched on this a little bit, but the thing that drives me probably the most crazy is they're stupid on both sides of the aisle, which is why you kind of frame this, the purple thing. It's about both sides of this coming together for better health care. Whether you're people on the left talking about you just need banana oil to cure your HIV because Dr. Sebi said so, or if you're people on the right talking about you don't need measles, mumps, or rubella vaccinations, your kids will be fine, when if you catch that stuff, it's with you for a lifetime. How do we bridge this gap of, I'm just going to be upfront what I think it is, this gap of stupid, not necessarily stupid because, I'm just going to stop that. How do we bridge this gap of bringing better literacy to people.
Yeah. One of the things that I think that's really important, and sort of, one day you'll do a podcast and it'll just be all healthcare. So we have to do a better job at messaging. And we are really behind, I think, in public health, in medicine in general, at messaging appropriate scientifically based clinical information. And so I can get on a podcast, or I can, do my own podcast and talk about clinical care all day long. Mm-hmm. But unless I have some sort of angle, people are not really going to be attracted to me. And they're going to see me in the same light as they do Joe Schmo, who has 1 million followers.
Yep.
Because what has happened, I think, over the past few years, and it's been a slow trickle that I think was accelerated during COVID, is we don't really trust institutions, and part of those institutions are public health or clinical medicine. And so I think as we've gotten more access to things, social media has really taken over. We have Google, we have AI. People are trusting those things a lot more than they're actually trusting the so-called experts. So I think we have to do a better job of getting that information out. And I think bridging that divide between the left and the right, which again, the book sort of said there shouldn't be a divide. You are all looking for the same things, is really to be realistic. I think on either side is not realistic. We have to do a better job of trying to get healthcare to as many people as possible.
Yep. Yeah.
And the money is there, and I will say that the money is there. We have enough money in the country. We have enough money in the health system.
Right.
It's how we're using that money and funneling that money that's problematic, and the reason why we can't cover a lot more people. And so I think if we're more realistic about that on both sides, I think that will help us. Because one of the things that we're looking at now is just the expense of healthcare.
Yep.
And so we can't say we're going to cover everybody and give them, the top of the line commercial insurance, because that would bankrupt us. But we can give people a basic health care and health coverage, where we can get the most things that they need. You can get the most of the primary care. You can get the most of the generic medication. If they happen to go into an ED or hospital, which you want to try to avoid, you should be able to cover that. The basics you should be able to cover. There's the money to cover that. It's just a matter if there's the will to make sure that we're funneling that money in the right place.
I don't want to take this into a political direction. I don't. But I feel like there's agendas where misinformation comes out, which that also confuses the public. Mm-hmm. The wearing of masks, the vaccinations, where you got one side saying this needs to be done for your health, and you got the other side saying, you don't really need to do it. And it's not really a question I'm adding. I'm just like coming off of what you're saying. That's literally what we saw in 2020. And then also Jill did the norovirus. She was on Channel 10 back, when that came out. It was the first thing. And that was the first time, we watched movies like Outbreak and all these other things where these movies were going on. And like, it's interesting, but that was the first time where like seeing her answering questions on Channel 10 at the time, where I'm like, shit, this is like real. Like, this really, really can happen. It's not Dustin Hoffman in a suit trying to break this strand that came out. So just your thoughts on that misinformation that comes out for agendas.
Yeah, I think there are certainly agendas that cause that misinformation. I always say follow science. I think one of the things that happened during COVID, unfortunately, is that everything was moving so rapidly. And there was a lot of confusion, and we saw sort of the scientific method in real time. Science is something that is compiled over years, and you're constantly trying to reevaluate the hypothesis and adding more information and making it better and making it more precise. And when people saw the sausage making, that made them like, oh, well, they don't know what they're talking about, because they keep changing every day, but usually they don't see the sausage making that's happening in the background. Right. And then once it's done, then they're like, okay, this is what we should be doing. So I think that was definitely one of the issues with it. And I think we just have to, again, get better, I think, at that messaging and making sure we're putting out the appropriate messaging for people so that they can retain the information and make the right decisions.
I mean, one thing that I was supposed to wait till after the show, but I think now is probably a really good time. Dan's been complaining about a rash. I'm tired of hearing
It's
him
always a
complain.
rash.
It's a lie.
It's a rash or maybe a short
It's a lie.
shoulder.
It's a rash. See how you just moved up gingerly? That's the rash.
Yeah.
Can we just get him?
No rash people.
It's usually
No rash
cream. It's usually cream.
I mean, just
Cream, no ointment.
give him a script.
My skin is clean everywhere.
Okay.
Yeah, well, I'll write you a script afterwards.
I do want to circle back because we're running short on time because he told a story on the call that we didn't get to, and I just want you to talk about Mr. McMiniman real quick because
Mr. McMiniman.
because I got to follow up to that.
So this is really this actually goes into the story I was telling earlier about dorm disorder. So I was never really a part of the dorm disorder, but I love to observe, and I just found it hilarious. So akin to that is we had a substitute teacher, Mr. McMiniman, who we had actually multiple times. But this particular day, we were in class, and I think it was supposed to be English class, and he proceeded to teach. He wanted to teach a lesson. And so he's writing on the board and trying to teach the lesson. And every time he would write on the board and turn his back to the class, books would go flying, like huge, gigantic books flying across the classroom. And it was literally like a movie because he would turn around and then everybody would stop and put their hands on the desk like nothing was happening. And I'm dying, I'm cracking up. Once he kind of figures out what's going on as he sees the books pile up on the ground, then unfortunately we had he called the principal, and she came down and kind of got us in order. But we were talking about it, it sort of went against the guiding principle of being a substitute. You are not really supposed to teach as a substitute.
Yeah.
And I say that as a scholar. Your teacher can leave work for you to do. You can do that work. You can leave a worksheet. But as a substitute, you're not supposed to stand up for 30 minutes and really give a lecture because the expectations are wrong. The kids are not expecting a lecture. Yeah. They're expecting basically a free day or a very short day where you have to do a little bit of work. So he did kind of break the cardinal rules of being a substitute and trying to do that.
So that was middle school. I wasn't in 94 then, but we had Mr. McMiniman for a math class, and I think we were in 8th grade in the class in 93. And Mr. McMiniman, I don't know if it was, obviously it was a health issue, I don't know what it was, but smelled like pee. Like really, really, really bad. So this I've already asked Jesus to forgive me. So we're in this class, and for whatever reason, for this particular day, he's like getting close to everybody and looking at their answers. And 3 or 4 people right in a row. Ew, you smell like piss. Ew, you smell like pee. So it was like 4 times. And he didn't say nothing. He walked to the desk. He got his briefcase. He got his keys. He walked out the room. Oh, wow. And we were in the middle school, so, like, you could, the room we were in, like, it was the very first room, and the room next to it was the English class. It was McInerney. So we were right there, so you could see right out the window. Like, he literally just got in his car
and drove away.
And I don't think we've ever seen him since.
Wow. And the gumption to, as a student, to say you smell like pee, not to share with each other, like, I think he smells a little bit weird.
No, it was his face. It was straight. That goes back to not telling people you live in the car for a little bit. Nobody needs to know that. You can't be coming in smelling like urine and then getting right on top of people to go over their math
He
problems.
said, I have had enough. Yeah. This is the end.
I think at first he was like, I had the condition, like he tried to appeal to our side.
That probably made it worse.
And he tried to get worse. Because then people started laughing even more. So he just left, man. It was crazy.
You drove Mr. McMiniman away.
I still feel bad about that. Class 93, I need y'all, come in the comments when you see this, please, because I know y'all remember.
And truth be told, like, I call you an asshole all the time or say you were an asshole all the time. We were all assholes.
Yeah.
That's just the honest to God truth. We were all horrible people. So
when people like Steven would laugh, it's like such a distinct laugh. So and he was so good and he was so smart. Whenever he would laugh, like it would set me off too. Like it just thought, you can't help but just laugh at what was going on.
Well, I don't know if we have time for one other quick story. So I always remember this story. This happened in middle school. I believe we were in 6th grade. And this is when my laugh got me in trouble. And something happened to Eugene Riley. God rest his soul.
Yep.
And I don't remember exactly what it was, but I know I was laughing so hard. And he got really upset with me, and he proceeded to choke me.
Oh,
so
wow.
he put me in a bear hug, and he was choking me. And mind you, I was laughing the whole time this was happening. I wish I could remember what was so funny, but I was laughing the whole time. And soon after that, probably a few hours later, I received word that Jermaine Lennon punched Eugene Riley because he tried to choke me.
Oh wow.
So me and Jermaine were pretty tight. It was also weird because throughout my history in Girard, for some reason I had this yin and yang thing where I had friends who were just like the total opposites of me, who I should have. In fact, Jermaine Lennon I tried to show to Janet Jackson too, and he was like, bye. But I remember that distinctly, my laugh getting me in trouble, choked by Eugene Riley, but then Jermaine Lennon set the naked right by punching Eugene Riley.
And you still managed to wrap that back to Janet Jackson.
Exactly. You saw how I did that.
It's a callback. Rhythm Nation.
Everybody, there's the book, Purple Bud. Get this. Support Steve. Feed your own mind. It's not. I've already like pushed through like a whole chapter.
It's an easy read.
It's an easy read.
Yep.
And that matters because I'm also blind, and the words are nicely spaced. Great text. So please, Steve, this was one of the most amazing times I've had. This was just fun. Thank you so much for joining us. We hope that we get you back at some time in the future, and wish you and your family all the best.
Thank you so much for having me.
Yep. Near that, thank you so much to the Philly Podcast Space for giving us a new spot today. Looks really nice. I really appreciate it. Steve, thank you for coming. It definitely brought back some memories, including who finished second in our class. I'm not, we're going to call a name, but I actually forgot about that. I knew you were first, though. I knew you were first because just going the 4 years we were together, it was, can tell you were going to be a doctor or something really, really important. So it's great that you came back to share that with us. And congratulations for all your hard work and all your endeavors. And class of 94, we're all a bunch of assholes.
Should we sing the encore song?
No, God.
Your love deserves a 9-4.
Thanks, everybody. We will see you in a few weeks as we take a small hiatus, but we will finish up the summer and take you into the fall. But you all know that we also have football season and we don't do this. There's a bet we still got to deal with.
Yeah, I'm saving that for the last episode. Don't worry. We're going to call back on that. So, how we're ending the episodes from now on, there's no more peace out. There's no more none of that. What they used to say to us just before they told us to go to bed, and we hit dorm disorder, lights out.
You've been listening to the Dorm Disorder Podcast. Until next time, lights out.